We're going to talk about treatments for alcohol use disorder. There's a lot of people wanting to stop drinking. There's a lot of good treatments that can help them do that. Today we want to look at three main categories. We're going to look at peer-related group things that they can do. We're going to look at therapy interventions that they can do, and we're going to look at medications. So the first one, peer. Most people have heard of AA. It's an incredible organization that can be very powerful for people with alcohol use disorder. It's actually led completely by people in recovery. They have a basic premise with 12 steps, a book that they go through, a structure that they go through. They're not something that's supervised by the medical world, and it's very individualized. Each group is its own kind of group, its own identity. I think it's important that people realize they may need to try multiple groups until they find the one that's a better fit for them, because not all groups are the same, and not all groups are going to fit an individual's needs. Number two, therapy type interventions. Some people do skill-based groups, some work individually with their therapist, but they're going to be specific evidence-based therapies. A lot of the therapy techniques are going to be based on behavioral principles, understanding how that behavior is getting triggered and how it's getting reinforced so that we can help break that cycle and create behavioral change. And the third category is medication. There are three main medications that are used in alcohol use disorder. The first one is the one I recommend most often, most commonly. It's called naltrexone. It's something that actually blocks the opioid receptor, so people can't take it with heroin or painkillers or other opioids because it would block that and it could cause withdrawal. It's something that's been very effective in decreasing cravings for people with alcohol use problems, decreasing heavy use, as well as decreasing hospitalizations and some of the medical problems that can come up with it. The second medication is a camprosate. Camprosate is a medication that seems to be balancing out some of the chronic changes that happen with heavy alcohol abuse. It tends to mild out some of the anxiety, the insomnia, some of the negative longer-term things that people can feel as they're coming off of alcohol, and it can really help people stop drinking as well. The third one that I'll mention, antabuse or disulfiram. This is a medication that actually blocks the breaking down of the alcohol. Acetaldehyde builds up and people can have a very violent reaction. Vomiting, flushed, you feel awful. The idea is not to make them actually go through that. The idea is you're really allowing someone to say no to drinking at an earlier point when they're more motivated. That wraps up the three medications that we use for alcohol use disorder and the three treatments overall that are very helpful in getting people into recovery and successful with their recovery.